So today we are going to discuss quickly about how to augment diuresis and achieve negative fluid balance in pediatric ICU. This is a very common issue, especially in pediatric cardiac surgery experience. I mean, every time you start round in the morning and cardiac surgeon, they are asking you, what is my balance, negative balance, because everything depends on your cardiac output. And the most important thing, especially before extubation, to get a negative balance and to augment diuresis. So what are the benefits? Obviously you can end up by having a better lung compliance because and less chest wall edema. On X-ray you can see, and which will result into your extubation success. But while you are doing an augmenting diuresis and getting negative balance, be aware of acute kidney injury, especially if the patient is passing less urine. Drug interaction is very important because there is a lot of drugs which can interact in pediatric ICU and can injure the kidney. Drug dosage adjustment is the most important thing in the patient care. And also you can keep eye on the urea and BUN creatinine. To somehow to get a negative balance, we want urea almost 1.5 times of normal, but if the urea is going more up, maybe you have to hold your diuresis. So what factors can improve the patient diuresis? The most important thing, you need to improve the cardiac output by optimizing the preload, contractility, afterload and diastolic function. In other words, you have to get the better mean arterial blood pressure to augment the kidney flow and end up by having a better GFR and better diuresis. Lot of times you have to use albumin to get the better oncotic pressure, and also you have to use diuretics very judiciously sometime, because especially in cardiac surgery or any pediatric ICU patient, obviously you need to have some amount of conscious controlled diuresis. And most of the time in cardiac surgery before extubation, you have to put them on Lasix plus diureal drip, which is hydrochlorothiazide. Proper documentation is the most important thing, and strict intake output charting, and this area need to be improved. Fluid balance, you have to keep eye every 4 hourly. I mean, lot of times you plan and you come to know you come for the round in the morning and patient is in positive balance. So you don't wait for 12 hours or 24 hours to check. You have to calculate intake output every 4 hourly. Calculate all things, including medication, blood products, boluses and infusions. You have to sit beside the patient and calculate everything with the nurses. And I mean, you have to review your intake output every 4 hours, and suppose after 4 hours your intake is more than your output, so how you are going to get negative balance? So if you are trying to get negative balance, so your output has to be better than your intake. After every 4 hours you need to review. I mean, case by case, you can use aminophylline. Aminophylline definitely has some side effects, but also it helps, especially in small patient, augment diuresis, and also it has a lot of benefits in terms of the respiratory muscle endurance, and in small babies also it stimulates the respiratory centers. And you have to work with the drugs which can improve your vascular tone and ending by having a mean arterial pressure better, like hydrocortisone, thyroxine or IV calcium gluconate, case to case. And obviously if you are not getting negative balance and you are positive, that's a problem, because it's difficult to extubate these patients, especially cardiac. And think about increased abdominal intra-abdominal pressure, intra-abdominal hypertension you have to rule out, because if you are not getting negative balance, maybe patient has lot of fluid in the abdomen and causing intra-abdominal hypertension, and you have to put the drain, which will improve your urine output and end up by having a better diuresis.